Washington, the Trump administration said Saturday it's freezing payments under an Obamacare program that protects insurers with sicker patients from financial losses, a move expected to add to premium increases next year. At stake are billions in payments to insurers with sicker customers. Rumors that the Trump administration would freeze payments were circulating late last week. Alex Brandon, the Associated Press file photo. In a weekend announcement, the Centers for Medicare and Medicaid Services said the administration is acting because of conflicting court ruling and lawsuits filed by some smaller insurers who question whether they are being fairly treated under the program. The so-called risk adjustment program takes payments from insurers with healthier customers and redistributes that money to companies with sicker enrollees. Payments for 2017 are $10.4 billion. No taxpayer subsidies are involved. The idea behind the program is to remove the financial incentive for insurers to cherry-pick healthier customers. The government uses a similar approach with Medicare private insurance plans and the Medicare prescription drug benefit. Article continued below. Major insurer groups said Saturday the administration's action interferes with a program that's working well. Read more. Opinion: Jillian Stewart, Trump proves Canadians got it right on healthcare. Trump isn't excellent health, got perfect score on cognitive test. White House Dr. Trump lets states make poor people work for their health care. In Kentucky, many say they're now facing a dead end. The Blue Cross Blue Shield Association, whose members are a mainstay of Affordable Care Act coverage, said it was extremely disappointed with the administration's action. The Trump administration's move will significantly increase 2019 premiums for millions of individuals and small business owners and could result in far fewer health plan choices, Association President Scott Sirota said in a statement. It will undermine Americans' access to affordable coverage, particularly those who need medical care the most. Article continued below. Sirota noted that the payments are required by law, and said he believes the administration has the legal authority to continue making them despite the court cases. He warned of turmoil as insurers finalize their rates for 2019. America's health insurance plans, the main health insurance industry trade group, said in a statement that it is very discouraged by the Trump administration's decision to freeze payments. Costs for taxpayers will rise as the federal government spends more on premium subsidies, the group said. Rumors that the Trump administration would freeze payments were circulating late last week. But the Saturday announcement via email was unusual for such a major step. The administration argued in its announcement that its hands were tied by conflicting court rulings in New Mexico and Massachusetts. Medicare and Medicaid Administrator Seema Verma said the Trump administration was disappointed by a New Mexico court ruling that questioned the workings of the risk program for insurers. The administration has asked the court to reconsider its ruling, and hopes for a prompt resolution that allows the government to prevent more adverse impacts on Americans who receive their insurance in the individual and small group markets, she said. More than 10 million people currently buy individual health insurance plans through healthcare.gov and state insurance marketplaces. The vast majority of those customers receive taxpayer subsidies under the Obama-era health law and would be shielded from premium increases next year. The brunt of higher prices would fall on solid middle-class consumers who are not eligible for the income-based subsidies. Many of those are self-employed people and small business owners, generally seen as a Republican constituency. The latest Obamacare flare-up does not affect most people with employer coverage.